Try to stay timely with these programs. Welcome. My name is Abby Demas. I'm the Executive Director with the Erie County Economic Development Corporation. I believe many of you participating today joined us in a webinar series we hosted last year in conjunction with the Erie County Health Department. We like to call these our business briefings that ran from, say, March to June last year. As you all know, the environment around business was changing rapidly, still is. And the goal of these programs is to provide sort of a local flavor as to what we're seeing and in local, state, national news. In particular, as we thought about 2021 and we're speaking with businesses in the community, we're hearing a lot of optimism about what the future will bring this year. And we want to be sure that we're keeping you up to date with opportunities for your business, programs for your business, just food for consideration and planning as you look at a strong 2021. So today's program, we are doing just that, a little bit of level setting as to what we saw in terms of environment and change over the last year. We're going to, as usual, hear from the Erie County Health Department again throughout this series. So thank you to Abby Schwanger for joining us as a regular panelist on this program. Great to sort of hear through the national headlines at a local level. And then we're also joined by Jacob Dritsky with Team Northeast Ohio, a development partner of ours, who's going to talk about the 2021 economy projections their team is expecting. And we'll hear a little bit more about that from our team, Sarah Ross, our program director with Erie County Economic Development Corporation, to close the program. So I will start here as we sort of just 10,000 foot view of what we think is relevant to business right now, programs, things that you need to know. Again, we concluded this series about June of last year. So a few of these bullet points that you see on the screen are sort of hindsight, but good to look back on what was done around small business support in the pandemic age and what to expect going forward. At a local level, you probably heard from our office a lot throughout last year. There was almost $300,000 deployed through Erie County, the city of Sandusky, our townships, and private foundations in small business support programs. A few of those are ongoing, which Sarah's going to talk more about at the end of this program. So wanted to note those opportunities for you. At a state level, also several programs rolled out, $125 million in small business assistance, a bar and restaurant assistance fund. Both of those programs are currently closed, but some of you might have been reading in the news about new programs potentially coming out in this year's budget. So Ohio is working through their budgetary process right now. You may have read about some line items in the executive budget that was proposed by Governor DeWine that did include small business support, almost $460 million in sort of a targeted agenda. What we wanted to note for you right now is there's nothing you need to apply for today that's open that we're aware of at a state level, unless it's a typical economic development project that you're working on for your business. But we do want to encourage everyone to make sure that if you are interested in future programming, have you registered for your Ohio ID with the Ohio Business Gateway, applied to any previous programs. That's how you would have done that. And we heard from a lot of people throughout last year who ran into application challenges because of the Ohio ID process, or maybe your liquor license and the Ohio Department of Taxation didn't follow the same employer identification number. Just a lot of those potential headaches in the application process. We'd encourage you to take a look at those now and make sure your I's are dotted, your T's are crossed, because our suspicion is that new programs that are rolled out in the next fiscal year will use a similar structure, infrastructure to deploy those resources. So make sure that you're prepared in that way. Also outlined in the executive budget was several programs potentially around training. So I wanted to note our workforce development team across Erie and Huron County is called Firelands Forward. Some of you may have met with Alex Jones or Kelly Beatty from our team. who specialize in workforce development, along with many other local partners like Ohio Means Jobs. They are all resources as you're planning for your business future and thinking about what does my business need, bringing back talent, training talent for a new business paradigm. They have a lot of resources to potentially connect you with around training support. So I would refer you to Alex or Kelly with our team to get started as a good entry point as you're thinking about resources. And then finally, I'm sure you're reading a lot of federal news, active debate around a latest stimulus package. Two things that you're probably aware of right now is the second round of the Paycheck Protection Program is open for applications. For a second draw of that program, your business needed to have had a 25% reduction in gross receipts for at least one quarter last year. And you could again get 2.5 times your monthly payroll, or 3.5 times if you're a food and beverage business in a second draw. If any of those programs, we can be a resource and sort of guiding you through, please don't hesitate to reach out. I'm happy to just brainstorm about have you exhausted all your options. And then I would say a lot of that sort of pandemic focus, but don't forget at an economic development level, times that you want to be reaching out to our team. Maybe you're considering a new product line. Maybe you have facility concerns and are looking at a new location. Maybe you have training needs, as mentioned. So those are all potential times that you should be in touch with our team, and we could help guide you to potential opportunities. And then lastly, we typically update you on sort of changing regulations. A lot of restrictions in terms of business operation continue to be eased. And just last night, a special press conference with Governor DeWine set a target for when he feels it would be appropriate to reduce all health orders. So we have some notes about that on the screen, and Abby may cover in more detail. So with that, that is level setting. What's the picture now in the business environment? A lot of information. So I guess my real takeaway for you is if any of this sounds like you need more detail, we'll chat in our emails so that you know how to get a hold of us for further discussion. And with that, I'll move it on to the next portion of the program today, which Abby would love for you to take over here. Should I stop screen share?
Yes, I'll pull up my screen here.
Okay.
All right. So thank you so much for inviting me back, Abby. It's hard to believe that we're still here a year later, and I never really could have imagined that we would still be talking about this. So I'm glad to be here, and I'm glad that we've made it through this far. And you know, for those of you who don't know me, I'm Abby Schwanger. I am with the Erie County Health Department, and I'm the Director of Community Health. I do a lot of the marketing and public information. We do have an Erie County dashboard. If you're not familiar with this website yet, it's a really an important website that you should get familiar with, the COVID-ErieOhio.com. And we'll talk a little bit more here in the next couple of slides about other features of that. But we also have a dashboard there that has current case numbers. And we've had a total of, tested positive cases, 7,267. I'm sorry, the ones who've actually received a positive test would be 4,532. Those who are probable positives, which means that they were a close contact to a positive case and they are experiencing symptoms, is the 2,735. So total of all those is 7,267 in Erie County. There are probably many, many, many more cases that somehow never made it through and got counted. We've had a total of 191 deaths in Erie County up until now. So, that's been very unfortunate, but as you can see here in this slide, we are getting to a much, much better place. So back when we started doing these talks, we were probably like right around here. And we thought, oh my goodness, what this is just wild. In the, April, March of last year. And then, we've had a couple of spikes along the way. And then, of course, this winter has just been pretty monumental in the terms of number of cases. But we have I really think we're on the downswing. I really think we're coming up on a really good place. It's going to be really important that we all continue to just see it through. We're so close. And so, continue to follow those public health protocols that you've already heard about so many times, but continue doing that. We're very close to really knocking this out. And again, Abby did mention about the case numbers, DeWine possibly lifting those orders. So that's in our sights as well. The vaccines have been a huge part of the decrease in number of cases, along with those public health measures that you've been taking, wearing masks, social distancing, that all plays a part, and vaccines are so important. As of March 3rd, now the Ohio Department of Health's dashboard website has been down for a couple of days here. So these are the most recent statistics I was able to gather, but it has gone up quite a bit here. So 16%, over 16% of Erie County residents have received at least one dose of the vaccine. And those are Erie County's most vulnerable people. And so those ages 65 and older, healthcare workers, people who are really at risk, 16% of them have received at least one dose. Just under 9% are fully immunized. Again, I believe those numbers should be up a little bit higher. I know here at the health center, at the Erie County Health Center, we're doing 1,500 vaccines just yesterday and today. And so just huge numbers, vaccine numbers are coming, we're getting many more vaccines, and we're able to get those out much more quickly now that we're just getting those vaccines. That really has been the bottleneck here, is the number of vaccines that we've been able to receive. So I know at the Erie County Health Center, we have always, since December 23rd, when we began vaccinating, we have those vaccines in arms within 24 to 48 hours of receiving them. And so I know a lot of people have been frustrated. When are you going to vaccinate? When are you going to vaccinate? We are vaccinating. We are getting them out as soon as they arrive. So as those numbers increase, the number that we are being allocated, we will continue to get those out as quickly as possible. The vaccines are incredibly safe. I know that there's been a lot of discussion about, these have only been tested for a very short period of time, when actually mRNA vaccines, which are both Moderna and Pfizer, are both those mRNA vaccines, they have been in development and been tested for many years. This is not brand new. Of course, this is a new virus, and so it just had to be adapted for that virus. And of course, that happened very quickly. But the style of vaccine, the type of vaccine, that testing has been going on for many years. It's very safe. And when people ask me about how safe is the vaccine, do you have concerns? One of the statistics that I like to share with people is that, as of today, 54 million Americans have received at least one dose of the COVID vaccine. There have been no reports of vaccine-related deaths in those individuals. 28 million Americans, about half of that have tested positive for COVID-19, and over 500,000 of those people have died from COVID-19. So the risk here is really from catching COVID. There's a much greater risk of getting COVID than there is, of dying of COVID than if you get the vaccine. So there are some side effects that people are concerned about. I had the vaccine myself, and many of my coworkers have had it. Definitely 24 hours after the second shot, you feel a little bit run down, a little bit of achy muscles. That is caused by your immune system really getting boosted. You talk about boosting your immune system. It ramps up, it's fighting, and it's creating those antibodies to protect you from that virus. And so, it's a good sign. I know it kind of stinks, but it shows up about 24 hours, you're feeling better. So the side effects really are quite minor compared to, you know, the risk of severe illness and death from actually catching COVID-19. So definitely, you know, if you have concerns, talk to your doctor, but I definitely, you know, think that the vaccine is very much less of a risk than catching COVID. A lot of questions now about vaccine eligibility that has been expanded as of March 4th. So as of yesterday, they expanded from beyond the phase 1A and 1B. So now phase 1C. And so that is to include additional medical conditions, Lou Gehrig's disease or ALS, those who are pregnant, type 1 diabetes, and can't remember the other one. But if you have any questions, you go to coviderieohio.com, and that lists out all of the eligibility, the different medical conditions that are eligible. Also, different occupations have become available to them. So those who work in childcare facilities, those who work in the funeral industry, law enforcement, corrections officers, and also firefighters. So as for the medical conditions, at this point, we're not doing any verification for those. And so if you have a medical condition, you go on and, you know, register, schedule your appointment, and just ask that you attest that you have, you know, this specific medical condition, attest that you have it, and then you can schedule an appointment and get the vaccine. The age for receiving vaccines has also been lowered down to age 60 plus. So we are vaccinating, again, those medical conditions, additional occupations, and age 60 plus. And registering for the vaccine, we actually just rolled this out yesterday. Really excited about this. Those who, you know, have been involved in helping, you know, somebody in your life, an older adult, parents, to register for the vaccine, it's been kind of challenging. So, you know, we had a system where you registered for it and then waited for somebody to give you a call to schedule an appointment. And there were a lot of questions about that, and it wasn't the best system. And so we have now, we have rolled out this new vaccine system where you can actually schedule your appointment right there. So go to coviderieohio.com, and there's a big banner at the top. It says, click here to register for the vaccine. Click there, it'll take you to the website for registering for the appointment. You go through, it'll take you to this page. You can pick either Firelands or the Erie County Community Health Center. Pick which location you want to receive your vaccine. If you go into one of these and there's no appointments available, you know, back up and go and check the other one because one of them might fill up faster than the other one. And then it takes you to this next page where you can actually just click right there on your appointment time. And then the next page, once you choose your appointment time, then you fill out your registration information, and that's your appointment. You're all booked, you're ready to go. We do still have appointments available. There's plenty on there. So if you go to coviderieohio.com, if you are eligible for the vaccine, go ahead and schedule your appointment, get registered. We are registering and scheduling those appointments for the 11th and the 12th of next week. And, you know, we'll continue updating that as we continue to receive vaccine and we are notified of how much vaccine, then that's when we make those appointments available. There were some questions, you know, Abby covered it a little bit already about mass gatherings. They are still limited with the exception of wedding receptions and proms. Those are, for some reason, not included. So you can have a wedding reception as large as you want, and you can have a prom. But other than that, mass gatherings are limited still to less than 10 persons. And we do definitely continue wearing those masks and social distance if you're at a mass gathering with individuals. It's just taking those precautions, making sure that you have a little bit of extra space, wear masks. You know, the weather's starting to get much nicer. If you can do things outside, that's always going to be better. The risk here is really just sharing air with other people. And so if you can do, the things that are going to reduce the risk of breathing the same air, so having windows open, ventilation going, meeting outside, those are all things that are going to help mitigate the risk. We, again, are so close. So let's just see it through to the end. And again, as Abby also mentioned, Governor DeWine is planning to lift those public health orders when the number of cases is below 50 per 100,000. Erie County, I believe, now it is a statewide average, is what he's going to base that off of. In Erie County right now, we're a little bit lower than the statewide average. We're at about 137 the last time that the Ohio Department of Health updated their dashboard. So 137 per 100,000. So, we're not quite there, but we are getting close. We really are. So if we just continue to follow these protocols, we can get back to normal. We can really see the light at the end of the tunnel now. Employee guidelines. There were some questions about what to do if you have an employee who is sick. So this is something, it stinks, but if you have an employee with a cold, stay home. Stay home. Even if they think it's allergies, if they think they have a cold, they need to stay home. You can have them go get tested. You can get a rapid test done very, very quickly. And that can give some peace of mind, but it's so much better if they don't go to work and possibly spread even a cold, because if you start to have a situation where now you have multiple people who catch a cold in your office, and then if you get a situation where everybody has to quarantine because they're all having COVID symptoms, but it's all just a cold, and it can really have much more disruption to your work than if the one person who was initially sick can just stay home. I've been very heavily involved in the response and contact tracing, and I cannot tell you how many people I've talked to on the phone who end up testing positive, who went to work because they just thought they had a cold. They just thought that they had allergies. They had a runny nose, they had a sore throat, they had a cough, and they didn't think it was a big deal, but they ended up going to work. They ended up exposing maybe 5, 10, 20 other people. We end up having to close or quarantine entire classrooms, entire, businesses, because, one person just thought that they had a cold and they went in. And even though that person might not be terribly sick, you don't know if you have an elderly coworker or somebody else who has a pre-existing condition, we know that it could be very, very deadly for them. And so always, I just encourage people, stay home. And questions about travel restrictions as well. So Ohio still has this travel restriction for states, and it's not a restriction even, but for states that have greater than 15% positivity rate, which means for all of the tests, the COVID-19 tests that are conducted, if more than 15% of those come back positive for a specific state, the state is advising people to quarantine when they return from that state for 14 days. Right now, the states that are listed are Idaho, South Dakota, Iowa, Alabama, and Kansas. If you have a spring break trip planned to, Idaho or South Dakota, I would certainly, I would encourage you not to go. I would encourage you to not go anywhere for spring break, but I know that that's not, always what everybody else is going to choose. And so if you do plan to go somewhere for spring break, I would certainly avoid Idaho for COVID reasons. And I don't know. I've never been to Idaho. Maybe it's great. But for spring break, I would avoid it. And quarantine when you come back. If you do have to go, even if you go to any of these states, I would quarantine if I were to be out of state and exposed to other people upon return. And that is all I have prepared for the moment. If there are any questions, I would be happy to try to answer those.
Thank you, Abby. I did see one come through for you. One was a comment that the new registration system worked out really well for someone. So there was a kudos for that being a smooth process. But the other question we received, so when it comes to registration, is there a waiting list if someone doesn't show up for their vaccination appointment? We know that, those things have to be defrosted and don't want things to go to waste. And if there is a waiting list, could someone who's not in the current eligibility guidelines be able to be put on that list if there's no shows or cancellations?
So we just go down our list of people that have already registered for the vaccine and people who are eligible. And so we want to make sure that if obviously we're not going to waste any doses. We've not wasted a single dose so far, and we are not planning to waste a single dose. But there are so many people that are already registered. We just go down that list and call them if they're available to come in and get their vaccine. We will have them come in and get their vaccine right away if they are available. And so it's just the list is just the registration that we already have in place.
Okay. Very good. That's helpful. Other questions for Abby that people want to chat in or raise a hand? Two things I wanted to note from the chat. Sarah shared a place where you could get a rapid test. That was great advice. Also, thanks to the Erie County Health Department, a supply of disposable masks is available to local businesses. They're perfect for patrons. We've had a lot of people stop into our office to pick them up for their health center or their restaurant. If you are interested in a supply, please reach out to us. And thanks again, Abby, to your team for making those available to local businesses. Okay. I'm not seeing anything else pop in here. Abby, thank you for answering those questions that we did get in advance as well. That's really helpful. And I'm glad to see that Florida is not on that state list, because I feel like half the people I chat with right now are in Florida. So it makes a little bit better business practice for us Ohioans right now. All right. Thanks again, Abby. Everyone, please feel free to chat in questions for now. And also, I should mention, the upcoming programs are very much based on what is going to be most helpful to use. So if there are things that you'd like to hear from the health department, from our office in the future, that'd be another great thing to chat in the sidebar here. Thanks, Abby. And next up, Jacob, I'm going to hand it over to you. So we got a good picture as to what's going on in the political landscape, in the health landscape, and love to hear from your team on what's going on in our economic landscape at a regional level.
Absolutely. Good afternoon, everyone. Abby, as always, thanks so much for giving us a few minutes to share some of what we're seeing taking place in the market. Much like the comments Abby just made, I think it was about this time last year where we also co-presented and talked through the implications of some of what we thought might be happening very, very early on through the pandemic. And it's kind of interesting. It's a bit of a tale of two stories. Last year at this time, it's probably a little too optimistic relative to what happened, which ended up being a little longer, a little worse than most people thought. But with that said, I think right now, what you're going to see are data we put together late in 2020, which I actually think might be a little more pessimistic than it needs to be. So as you think about some of these trends, I think some of the encouraging signs we're seeing, some of the things Abby just talked about, but also some of what we're seeing coming through in the jobs numbers and others might bode well for sort of the trajectory of some of these projections over the next several months as we continue to track those. Quick reminder for folks on the call, Team NEO, Regional Economic Development Group, represent 18 counties in Northeast Ohio, partners with the Erie County Economic Development Corporation for years, represent Jobs Ohio as their partner, their network partner for the Northeast region of the state, really focused on 5 things: strengthening a better coordinated network, advancing new technologies, Internet of Things, additive manufacturing, a hyper focus, like everyone in economic development, on talent, growing a pipeline of competitive, particularly industrial sites over time, and then promoting Team NEO, Northeast Ohio, to the country, to the world. You can see to the orange there, in collaboration with our partners, some of the outcomes that we have had over the past, say, 6 or so years. Diving into the analysis, for those of you who maybe were here last year, this will probably look similar. What we're talking about right now is based on some fourth quarter data that actually came out in December. So we're missing a couple of months actually headed into 2021 and what that's doing to the economy, which is where that optimism, for me at least, is coming from. It had anticipated a second round of federal stimulus. So some of what you're seeing talked about in Congress right now is inherent within these numbers. Interest rates remaining low, which Jerome Powell talked about yesterday, should continue certainly through 2021 and 2022. No significant shutdowns. Would be hard to think about going back to where we were at, say, last April, May, June. No indication based on everything Abby said, if we keep doing what we're doing, that'll be the case. All that said, again, this remains a health crisis, and the best thing we can do for the economy in the short term, in my opinion, get vaccinated, make the economy safe to go out again. Consumers have confidence, spend dollars, and open things back up. So where did 20 end, and where do we see 2021 going? When we had this chat last year, you'll see Northeast Ohio in orange. This is a look at change in employment. We thought Northeast Ohio at that point in time was probably going to decline 5 to 6%. We ended up declining somewhere in the 8 to 9% total range, a little more than what we saw in the US, which is at about 6%. That trend, unfortunately, through the pandemic recession, something we saw in 2001, something we saw in the Great Recession. Our employment base tends to get hit a little harder, still largely manufacturing for a lot of reasons, but that shows up in the data. What it has showed is heading into 2021, initially late last year, projections where we would probably gain only 0.5% back. Reason for optimism, like I said, around that, for anyone that saw the jobs report that came out this morning, 379,000 new jobs added in February to the economy. January numbers, which were a little anemic, were actually revised upward. So encouraging signs there. That is not to make light of the 9.5 or so million jobs that still are unfilled from where they were, say, February 2020. Still plenty of work to do, but some encouraging signs and some of the things we're starting to see. I would say that's starting to filter into the way we're thinking about 2021. This projected change in employment looks at where our best guess is late last year of heading into 2021. If we looked at this for last year, you would have seen that every single sector of the economy saw significant declines, somewhere in the 2 to upwards of 10 to 12% range. For 21, the projections right now are a bit more of a mixed bag. You do see sectors like oil and gas, real estate, education, all continuing to project declines. Accommodation and food services, much smaller than it was at this point, even midway through, say, 2020. But about half of the economy, healthcare, finance, professional services, construction, now projected to add net new jobs heading through 21, anywhere in the 1 to 3% range. This is sort of where you get that very small gain situation from, which is you've got a very bifurcated recovery projected for 2021. Half of it really seeing net growth in demand and employment, and the other half continuing to struggle to add jobs, but more to come on that. When you look at the largest projected gains going into 21, a lot of it not that surprising. Anything related to ambulatory health, digital telehealth, telehealth has been huge as we've converted to new ways of consuming healthcare. Anything related to IT, particularly professional services, data processing, hosting, companies who have helped other companies remain in business through this pandemic are still doing really well. And seeing some of that heavy construction come back, civil engineering, construction of buildings, a lot of that tied to state and federal contract dollars, and small signs that elements of manufacturing, particularly transportation equipment, so think around here, automotive, aerospace, and their embedded supply chains, could be seeing some rebound too as consumer demand for some of those products continues to grow. Biggest losses right now projected, anything that requires a significant portion of in-person attendance, still going to see the biggest losses. Performing arts, spectator sports, museums, things like that. Late last year projected in the 20 to 25% decline range. Again, as I look at this and have a reason to be optimistic, the quicker that we start putting into place, the ability to go back and do things more fully as we did before, the better these numbers are going to look over time. So in many ways, listening to the advice of Abby, in my view, and again, I'm not a public health official, but if you talk to a lot of folks who study the economy, that is going to do more to contribute to how we think about shifts in these numbers over time than any policy or any stimulus dollars certainly can. GDP, a slightly different story. 2020 saw declines only in the 5% range or so. Had you asked me back in March, and maybe you did, of last year, where I thought this was going, we were seeing 8 to 10% decline, so not as bad as we thought. In a much quicker recovery, GDP now projected to gain most of the ground back in 2021 and start adding net new growth in 2022. So there's sort of two things to think about. One is the lens of what the pandemic did, and that's obviously extremely important. But the second is sort of the structural issue with our economy over the past couple of decades, which is employment gets hit harder than GDP. GDP recovers more quickly. And what it really tends to do for our base of industry is drive productivity a little quicker. So you see productivity gains is one of the signs of economic health for our region that doesn't necessarily have a growing population, that has a slightly aging population, et cetera. Trend should remain here. A much, much more optimistic story as it relates to GDP throughout the economy. Most sectors now projected to see gains anywhere in the 1 to 8% range. Only four sectors, accommodation and food, some areas of arts and entertainment, transportation, warehousing, and oil and gas projected to see some declines. I know I sound like a broken record, but all of this very much subject to change based on how quickly we can open the economy back up. Largest projected gains heading into 2021. Again, you're going to see IT embedded throughout there. Sectors like furniture, home furnishing stores, a lot of people have, instead of doing, like going somewhere fun, have just invested that money into their homes, absolutely showing up in the data. I know we redid our backyard and then yesterday squirrels were digging it up, but that's not a story for today, but for a different day. Anything related to what I would call the Amazon economy impact. So we'll see in a couple of slides sort of the winners and losers out of this, but the way we consume goods was already changing, has absolutely been accelerated by the pandemic. Home delivery, packaged goods, just the way we've consumed products changed dramatically, and we're seeing that show up in the data as well. Largest declines, certainly things like air transportation, performing arts, museums. Again, really, if you look through there, you can see that 8 or so of the 10 require some level of high in-person attendance to drive GDP in those sectors. So continue to see struggling there. Air transportation, the one that far and away, potentially upwards of 50% of GDP, continuing to get hammered as a sector. So when we've looked over the last year, 8 to 12 months, have been sectors that have done relatively well through a pandemic. The conversion to personal protection equipment, PPE, that some manufacturers were able to take advantage of has boded well for a lot of different companies. Food and beverage manufacturing, particularly prepackaged food, home alcohol consumption. In some ways, there are things like aluminum can shortages based on the amount of goods, beer, and otherwise that people are consuming at home now rather than going out and doing it. IT's done great. Paper, corrugated fiber, cardboard boxes, that gets back to that Amazon economy impact. Everything shows up in a box, right? So demand for things like boxes has been huge. And then the facilities and logistical systems to deploy those resources. Losers, chemicals have had a hard time over the past couple of years. A lot of that's global volatility, though. Not a lot we can do locally about that here. Fab metal, primary, as we saw significant slowdowns in consumer demand for some of those larger products and purchases. Headquarters has been a bit of a mixed bag. If you're fairly sophisticated or at least forward-looking headquarter environment and we're able to go remote and have a digital environment, you've done pretty well. If you weren't set up for this beforehand, you've probably struggled to come online in a new way. And then oil and gas extraction continues to struggle as well. So I've probably hit on all these points in some way, so I won't read through them individually. But again, it remains a health crisis. I can't drive that point home enough, unlike anything we've ever seen. But there are, to Abby's previous presentation, really signs of hope. I think encouraging signs in the economy, though we have a long way to go, no doubt about that, to get back to where we were. But if we can continue to ramp up the way people are getting vaccinated, it should bode well for the future of what we're doing here. So with that, I will stop sharing if there are any thoughts or questions, and I appreciate the time this afternoon, I guess it is. Yeah.
Yeah, everyone, welcome to chat in a question or observation for Jacob here. I'll just comment that of the winners and losers that you mentioned, I know two of the biggest projects we worked on locally last year were around conveyor belts for distribution centers and then metal cans. So
Yep.
we can very much in Erie County attest to what you're saying is true.
It's an odd phenomenon of the pandemic that when you go in and can't find your favorite soda or favorite beer or whatever your beverage of choice is, it's not because they can't make the beverage itself. It's because they probably don't have enough inventory of the cans that are properly labeled.
Yeah. And it has been interesting at a local level. Last year for our office, it was the biggest investment and jobs numbers we've actually worked on for new projects in the years at least that I've worked for the organization. But at the same time, just like you outlined, there is certainly still sectors of the economy feeling pain here. And so I think your presentation connects a lot of dots. If you look at what programming is being rolled out for business support, the industries that are being targeted there, health restrictions that Abby's mentioned, and then what we're thinking about the future. Hopefully those dots continue to align for resources. And I'd encourage people listening today that if there's something that's going on in your industry that you think economic development and planning need to be aware of, please reach out to us. You know your business best. Any other questions for Jacob? Very good. Well, thank you, Jacob, for joining us. As always, insightful. And I will chat in contact information for all of our panelists here in a minute. But to close out our program today, I'm going to hand it over to Sarah.
Thanks, Abby. Can you share the PowerPoint?
Yes. Good call.
So I'm just going to follow up Abby's comments and, commenting on some of the Ecadec having worked on some of the largest capital investment and job creation numbers in her time here in 2020. And it's really been a tale of two economies. And so I just want to highlight what we've seen in our office as to who's been hit the hardest, kind of the disproportionate impacts and effects. And you've seen this in our programming and in our communications, but we've really seen a really hard impact on small businesses. It's just, especially here in Erie County, we rely on our inflated population during the travel months. And without that inflated population last year, it's been just an undoable math problem for many of our small businesses. And then minority-owned businesses across the country, we're seeing higher rates of closure, more difficult time access capital, and basically we refer to these as aggregate barriers on these minority-owned businesses. So I'm going to get to a minute in kind of how we're addressing these. And then finally, the service sector, which Jacob's presentation basically, hit us over the head with. It's a especially important mix in Erie County's economy, and they've been disproportionately affected. So I just want to address kind of what we have available locally in these affected populations. So for small businesses, we continue to have our RISE advising program. Abby, if you could go to the next slide. Yeah. So we meet twice a month, and this is one-on-one. So this is to help address directly your business questions. So if the math problem has been hard in your business, we'll sit down and dig into that and help you find, your next audience to work with, or help you find how to break into e-commerce. The pandemic really accelerated some other trends, especially in retail, and our Rise Advising can help you with that. To support minority businesses, you may have seen in the register or on social media the recent formation of a minority business empowerment team. And this is a grassroots collaborative here in Erie County who, pandemic or not, is working to address our minority-owned business ecosystem and really improve opportunities for minority-owned businesses at any stage. But we were able to get some funding for a minority business recovery grant. So this is specifically for small businesses owned by a racial minority, women-owned, veteran-owned. We have $2,000 grants available, and the application is open for that now. Again, this is a pandemic-related grant, so the businesses will have to have been in operation prior to the pandemic. And we're just trying to help close that equity gap that we've seen. And then share a meal. I do want to go into detail on this as well. Going back to that service sector and restaurants being hit extra hard this year. This is a program in partnership with the Erie County Community Foundation and OGO, a local nonprofit. Basically, ECADEC is able to do bulk procurement of meals from restaurants. So we have funding to buy large orders of meals, depending on your restaurant's capacity. We can procure up to 150 meals on a given day from your restaurant. And these go directly to families in need in the community. So we just closed our last round of that last week, and we have 3 more opportunities coming up in April. So if you are a restaurant owner, or you work with a restaurant owner or know a restaurant owner, please send them our way. Again, all the outreach for this program is going through our office. We've been able to spread the love across Erie County. We've procured from restaurants in every community, from Perkins to Margaretta to Milan, Sandusky, Vermilion, and Huron. And we have also distributed across Vermilion, Huron, Sandusky, and Margaretta. So really hoping that we can continue to support more restaurants here. And then 2 more things. Just finally, we know there's going to be another round of federal aid. And so we're doing everything we can to stay on top of that and see how that will filter down through the state and then locally, and really be sure that we can design programs to meet our needs in Erie County. And, last year we were able to play a big role in designing those programs. So if you guys as our community have specific wishes for what kind of industries or what kind of businesses that should go to, be talking to us now so we can be sure the most pressing needs are met with that next round of aid. And then, as both Abby's mentioned, we do have quite a few. I have piles of disposable masks available for your business, whether that's for your employees, your guests, your clients, your patrons. So you just need to shoot us a message, and we're here every day. You can come pick them up, or we may be able to drop them off as well. So we have planned a short little series this year. This is the first one. We have 3 more scheduled of these Friday noon webinars. We're going every other week as regulations aren't changing as quickly as they were last year, thank goodness. So this is the lineup we have coming up over the next month and a half or so. In 2 weeks, we have guests from ThunderTech Marketing Agency, as well as KJK Law Firm. And we're going to talk about how customer service and marketing has changed, or if it hasn't for you, maybe how it should have changed given what's changed with the pandemic. And then we're also going to talk about the legal and practical implications of vaccinations in the workplace. So it'll be really good to have some legal advice there for those of us really looking forward to getting our employees vaccinated. Then in April, we'll talk about how managing employees has changed. As Abby alluded to, we have a lot more staying home sick with colds than we probably ever have in the past, and that really can truly change the team dynamics. So We have a team coach coming in for that, and then resources you may be able to provide to your employees in these challenging times. And then finally, as important as always in Erie County, our tourism outlook. So if there's anything else you want to see added to this lineup that we can fit in on those days or add another day, please let us know. Again, this is here to answer your questions. That's all that we've got today. So if you have any questions, please chat them in. We will email all attendees with the recording of this webinar as well as the slides, and you'll have all these resources that we've mentioned today linked there. So look out for that.
Very good. Thank you, Sarah. I'm just gonna pause for a moment and make sure we don't get any last questions through the chat here. And I will send contact information in as well for everyone.